So good afternoon, everyone. Welcome and thank you for joining us for the fourth session of the Public Health Alliance Regional Equity Learning Collaborative focused on advancing equity and workforce development. For those of you that may be joining us for the first time today, my name is Ana Bonilla. I use she, her, ella pronouns, and I'm the Health Equity and Justice Manager with the Public Health Alliance of Southern California. I am joining you today from unceded Tongva lands, which is currently known as Pasadena, California, in Los Angeles County. I'm also pleased to share that today I am going to be joined by my colleague, Delia Melendrez. She is the newest member of our Public Health Alliance team, and I hope that you can help me in giving her a warm welcome. Delia?
Hi, everyone. Good afternoon. It is such a pleasure to join you all in this collaborative session. So my name is Delia Melendrez Gomez. My preferred pronouns are she, her, hers, and it's great to be here with you all.
Wonderful. Thanks, Delia. And for today's collaborative session, we'll be holding space for conversations, cross-jurisdictional learning, and sharing around strategies to advance equity and workforce development, and taking it further to hopefully begin exploring and having conversations in earnest on how to move to action, both locally and as a larger region. And as we're moving on, I invite you to introduce yourselves in the chat as well. Please feel free to share your name, pronouns, and your role in local health jurisdiction as we get to know who's in the room here today. And while we're all sharing our introductions in the chat, I'd like to invite Tracy Delaney, Founding Executive Director of the Public Health Alliance of Southern California, to share a few remarks with us. Tracy?
Wonderful. Thank you, Anna. And as Anna mentioned, this is our fourth session, and it actually marks our midpoint in our inaugural collaborative. So we're very happy to have you here. We're also thrilled to learn that to date, many of you have already shared with us local successes that you've had that are rooted in your participation with this collaborative. So whether it's hiring new staff, creating an equity committee, or even catalyzing some critical conversations locally to help guide strategic thinking. So we're pleased that we're able to support the advancement of your equity work at the local level. We want to recognize that what this collaborative can also mean for our region. There's a lot of power that we hold collectively, and we want to start jointly thinking about how can we harness not just the power of local public health, but also from a regional perspective as well. How do we begin to think in terms of collective action so that we're creating meaningful change by coming together with shared actions and strategies? Today, we are at an exciting moment in public health. It's brimming with potential. Equity work is being funded as it has never been funded before. The state has recently approved and allocated $200 million for local health jurisdictions in ongoing funding in the budget. That's incredible. There's also a one-time hero budget allocation in the budget. On top of that, the CDC has recently released a new grant opportunity to support public health workforce, infrastructure, and data. It's critical that we collectively use these resources strategically and that we're intentionally centering equity. During our time together today, we hope to have deep, thoughtful, and necessary conversations on how we embed equity in new ways as we bolster and develop our workforce. What will it take to move this work forward both locally, and what guides us as a region? Both are questions I'm eager to dive into more with you all in this session today. Thank you for your participation today and for your enduring commitment to equity. Anna, I'll turn it back to you.
Wonderful. Thank you so much, Tracy. I so appreciate you helping to ground us in this space today and really elevating what an opportune moment it is for all of us. As always, we have our housekeeping rules that help us run a smooth virtual learning and collaboration space. I invite you all to keep your cameras on if you're in a space and place to do so. And as a reminder, we are recording today's session and we'll make the recordings available after today on our collaborative webpage. In these spaces, we also want to acknowledge, raise awareness, and hopefully spur action around our role as settlers in the US. We acknowledge the importance of land acknowledgements and want to keep moving us toward becoming better settlers. We're going to drop some resources in the chat that you can all peruse on your own. And so today, for our fourth virtual convening, we are recognizing that it is taking place throughout the unceded territory of California, as well as many other places across the US, which is home to nearly 200 tribal nations. We collectively acknowledge and honor the original inhabitants of our various regions. Now, during our last session, we were joined by the wonderful Trinice Polk, Director of the Office of Racial Equity and Community Engagement at the Boston Public Health Commission, as we took a deep dive into building capacity for authentic community engagement and co-creation. We took some time to understand equitable community engagement, power, and the role of government. But we also reviewed how to think more critically and as we move from more transactional engagements to more transformational approaches in the ways that we engage and partner with community.
Sorry about that. So for today's session, we're going to move beyond the theoretical and build on the foundational learnings that we've provided to date and take a deep dive into what it means to advance equity in workforce development. So during our time together, we'll define our shared terms of equitable workforce development to understand the historical presence of structures and systems that perpetuate inequitable practices. And we will start looking at the current state of the workforce, and more specifically, the public health workforce. Lastly, we'll move into some key learnings and recommendations that health departments can utilize to ensure equitable practices in their own jurisdictions. We will also hold space for conversations reflecting on current organizational practices and assess departmental strengths and opportunities for growth. And so we'll quickly go over the agenda to give you an overview of the day. We'll start off with our brief introductions, then we'll enter our opening remarks. Our guest speaker is Lori Williams from Stanislaus County. From there, we'll begin by laying the groundwork for workforce development and enter our first breakout of the day, where you will have the opportunity for some cross-jurisdictional sharing and learning. We'll come back for a 5-minute break. And when we return, we will be joined by our guest speaker, Alejandro Juarez from Multnomah County, who will share some of the equity work they are doing, including the Workforce Equity Initiative and Plan. And we'll break for an additional 5 minutes and close with the Equity Change Team breakouts, where you will discuss and identify opportunities to build capacity for advancing equity and workforce development.
Wonderful. Now, to help orient us to the topic at hand for today's session, I am very pleased and honored that we are joined today by Lori Williams. Lori is currently the Director of Public Health for Stanislaus County. Her career in public health spans over 3 decades, working in the Alameda, San Joaquin, and Stanislaus County. Before coming to work in the Central Valley, Lori worked as a program manager in Alameda County for over 25 years and as a deputy director for San Joaquin County for 2 years. In these roles, she was successful in developing, managing, and leading several programs and numerous initiatives. Lori is a caring, compassionate, and courageous leader, and she has a proven track record of managing organizational change, building strong teams, and successfully improving services and getting results. Lori received her master's in social welfare from UC Berkeley and her BA in psychology from UCSC. A social worker by training, she believes in racial justice, creating health, advancing equity, and the power of transformation. She is wholeheartedly committed to working in partnership with the community to ensure that all people have an opportunity to be healthy, to enjoy life, and to thrive. Today, she'll be sharing more about the work that she's leading in Stanislaus County and talk about why we must lead with an equity focus in workforce development. And without any further introduction, I'm pleased to hand over the mic to Lori. And Lori, I'm going to go ahead and get your slides up in just a moment.
All right. Well, good afternoon, everyone. Let me get back to a view where I can see you guys and not just myself. There we go. Okay. All right, so let me get right to it. I'd like to say again hello to Tracy. Good to see you, and hi Rigo. These are folks I recognize. I think Tracy kind of took my introduction, but I'll just say a few little things. We're definitely, as public health, at a crossroads. There's tremendous amount of opportunity, and I like what Tracy said in terms of it's just brimming with potential. And if you can kind of visualize that, it's just kind of spilling over. We have so many things that we can possibly do, but we're also challenged, as many opportunities that we have, we also have just as many challenges. And today, what I wanted to do is just kind of focus on recruitment, looking at that, through the equity lens, and really kind of elevating the prevention piece in terms of the type of work that we need to do. So I call my presentation Responsive Recruitment, because we got a lot of things that we need to respond to. So next slide. Okay, so I think, this is not a surprise to anyone. We got a lot of people leaving public health, and we're having a tremendously hard time bringing folks in. That is the reality that we're faced with. We're also at a place where for the first time we have some funding, and Tracy talked about the state funding. There's also some federal funding, and what's so wonderful is that this funding is not attached to programs, and so it will allow us to really build our infrastructure. But we're challenged because it's difficult to kind of really get folks into public health. Next slide. And so when we think about kind of why that's the case, we kind of have to analyze our current situation, our current state of affairs. And like I said, we have a situation where there is a lot of folks that came to help us during the pandemic and a lot that left. And we're also at a place where, although a lot of people are coming into, getting their master's in public health, they're not necessarily coming to public health. And so what we have to do is kind of figure out why that is the case and kind of bridge that gap as we try to get to this desired state. And this desired state that we're talking about is one where we absolutely do our work differently. We work very, very closely with community. We honor community. We share power with community. And we not only just go and ask questions, but we're in there together trying to solve some of these issues. So that's the desired state that we're trying to get to. Well, that's going to take some different type of people, and it's going to take some different types of skills. And so our task will be to kind of bridge that gap. Next slide. And so like I said, the public health is now one of the fastest growing majors. And so what we have to do is be very, very strategic in terms of kind of, well, how do we get them into public health? And I think there are some ways that we can do that. Next slide. So when we talk about paving the road to health equity, I know you guys are quite familiar with all of this. What I wanted to focus on is down there at the bottom, that infrastructure. The infrastructure really is the people that hold this together. And so all those different types of people that we need to help us with the data, to understand the issues, to help us go out into the community and work with the community, make sure they understand the data that we're presenting, and that we're presenting in a way that is palatable, and that is it makes sense, and they can really see what we're trying to do. So we have to spend our time really looking at that structure, the thing that holds it up. Well, what holds it up? People. People holds it up. So we really have to figure out, how do we get these people into our departments? Next slide. So if you remember nothing else from this, what I really want you to remember is just try something, as challenging as it is. And I'm sure you have been trying some things, but just stick to it and stay the course, because it really will take intentional efforts to really get the type of people that we need into our departments, to keep them there, and to do the type of work that we need to do. Next slide. So I wanted to emphasize community, and sometimes in the smaller counties, there, one of the common refrain that I hear is, "Oh, we don't really have that many CBOs, or the CBOs, they don't have the capacity." And both of those things may be true, but I think our job is to make sure that we build that capacity. And also, if you don't have that many, I think it really requires you kind of going out into the community and see what you do have. You just just might be surprised, kind of, who's out there really trying to move things. Because when we think about the communities that are really doing well and stay at the top of the rankings in terms of healthiest cities, it's the community. It's the community that kind of holds and moves a lot of this stuff. So, the power of the community to create health is far greater than any physician, clinic, or hospital, and I would say public health. So we really have to work closely with the community to get this work done. We can't do it by ourselves. They need us, and we need them. Next slide. So, this is just kind of repeating what I said. Alone, we can do so little. Together, we can do so much. So it is incumbent upon us to really, really, figure out how, who's out in the community, what are they concerned about, what are they focusing on, and how do we partner? How do we be better partners? How do we kind of bring our resources to the table and share, and not necessarily, step into a lead, try to lead the situation, but to kind of join ranks and really work together, partner together to address some of these really long-standing issues that are present in many of our communities. Next. Okay, so I love this little quote here. Your systems are perfectly designed to get the results that you are getting. I just absolutely love that. And what that does is kind of push us to really look at our systems. And so within your county departments, and you think about your HR department, your public health department, all the other areas that are working with you to recruit, to hire, to retain folks, what is the process? How does that even happen? And so what I would encourage you to do is just as you begin to kind of look at your recruitment strategies, make sure you start off by engaging with your HR leadership team, and really make sure that they're on board. And so those things that you can do on your own, do those, but the things that definitely fall into the HR's lane, make sure that they're able to and willing to do those things as well. But a process always can stand some modifications and improvement, but you got to first stop and say, well, wait a minute, how are we doing what we do, and where are there opportunities for us to do it differently? Okay, next one. Okay, so as you kind of look at your recruitment, I would really encourage you not to, make change too complicated, to just begin. And I don't know how I'm doing with time, but this is the meat of the presentation, because this is where I really want to kind of hone in on some of the things that I think you can do or continue to do. When you look at kind of centering equity, I think a real easy thing to do is look at your job descriptions and make sure across all of your job descriptions, when someone reads it, they really are clear about what you stand for, who you stand with, and what you stand against. You want to just make sure that just kind of comes off the page. So, what is your equity statement? Are there other kind of things that you really want to hold up? Quality? Are there soft skills that you want to make sure that everybody that comes to the table has? So that's your opportunity when you describe your department, describe the position, when you describe kind of the ideal candidate. You have opportunities to really lift up that language. So I really encourage you to do that. And then also with your questions, take some time and look at them and revise them as indicated, but make sure included in all of your questions is an equity question, or a writing sample, or something where you really can get a sense of their understanding of equity. And then also take the time to do some just-in-time training with anybody that's participating on your panels or helping you with your interviewing, so that they're kind of clear about what you're holding up, what's your philosophy, what some of your values are. Was that a little ting for me? And then also with in your your hiring process, you can use supplemental questions. That's always a good way to kind of get at what you want to ensure that people are aware of. And then to the extent that you're able, really take a look at your minimum requirements, because I think a lot of where things kind of stop and slow down is with our minimum requirements, and many people are really taking a look at that and changing those so that it's any combination of experience and education, and lived experience is also lifted up as well. So that's another area that I think is kind of stopping us a little bit. So those would be some areas that you can take a look at. And then just kind of lastly, when you think about kind of the work that we do and what people would say about us, what would they say about government, about county government and getting jobs there? I think one of the things that they say most often is very slow. We're very slow. I mean, we're like molasses slow sometimes. So we got to stop that. I mean, we got to really figure out how we can be more efficient. And then there's also the complaint about being cumbersome. Our processes sometimes are confusing. And then I think a big piece is the presentation. Sometimes it's not enticing, it's not attractive. And so those areas, all of those things you can do something about. And I think the criticisms are warranted. In some instances, you may not have all of these things kind of working against you, but these things do show up in many of our government settings. So, just kind of take a look at what's slowing you down, and then try to address those with some quality improvement. And I think Anna is telling me that we got a few minutes for questions. So that's kind of what I wanted to share in terms of, when you look at your recruitment, what are some pretty easy things that you can do to really lift up, elevate, and honor the work of equity.
Wonderful. Thank you so much, Lori. And I think you were able to pack so much into a little bit of time.
I know, 10 minutes. I was like, okay, I can do it.
And I know we can continue talking about this, but I wanted to make sure we had a little bit of space and time for folks in the audience to ask any questions. And, since I don't see any chat right now or any raised hands, I thought I could just kick us off with one, and hoping you can maybe speak to maybe a specific example on how you've been able to implement some of these strategies that you're talking about, and maybe it's how you're convening with your leadership or working in partnership. So anything on those two questions?
Yeah, absolutely. And that's a very good question. So first and foremost, when you're starting any of this, you got to connect with your HR department and try to bring them along and get them engaged. And then what I've done is I've set up what I'm calling like a change management kind of committee. And so we're using the principles and the techniques of change management to really look at the job descriptions, the questions, our process, our onboarding process, just looking at that whole process. How do they enter? Once they're here, what happens? How do we keep them engaged? And even all the way to when they exit. I don't know if people have looked at your exit interviews in a while, but you might want to. Do you get that? Some places get like a little summary, of kind of key themes that are coming out of that. Well, that helps you kind of plan. So if you're not getting that, that's something that you could ask your HR department to do. And I think, with working with your HR department, ask them for some of the metrics, because they're collecting stuff. And that will help you understand kind of what's really happening here. But start off by letting them know what you're doing and kind of getting their blessing. And make sure that they're engaged in the process, because there's some things that we won't be able to do, that our committee won't be able to do, that really does sit with the HR department. So I think that's crucial.
Wonderful. And I see two hands up, and Salfa, why don't we start with you?
Lori, thank you so very much for your sharing. It's so important to hear from other departments, from other counties, to know how they do things, because some counties are way ahead of us, and so we want to learn from what they're doing in order to do similar in our own county. And my questions are a little bit practical, I guess. in the county, we have our department, and then we have our agency, and then we have county, like the big county. And so I wondered in your suggestions that you made regarding policies, practices, and your equity statement, soft skills, description of the position ideal candidate. I wondered if the coordination that you did, or the change of practices that you coordinated, were they done at your department level? Were they done at the agency level? Or was this a county-wide endeavor where all departments are now under the same practices and policies? It's a little bit
Very
complicated for the
good,
bigger
very good.
counties, but I wonder how you're doing it in your county.
Yeah, and so you make an excellent point. And so, kind of looking at this system, you have to look at your whole system, and you did a very good job, because I think this is true for many of us. We have agency, we have big county, and then we have department, division, well, however you're identifying yourself. So right now, we're working in our department on these changes, and we can make the changes to our descriptions. We can now with minimum requirements. That's a more complicated process, but you still can make those changes. And so what we're doing with that is kind of lifting up a subset of those where the MQs are just really, really off, and figuring out kind of how do we move those forward, because a lot of that you do have to go to labor and meet and confer and that type of thing, but you still can do it. So to answer your question, we're at the department level, and it would be wonderful. I can just envision that we will get to a day when, for the whole county, you would see this language carried through all of the descriptions. You'd see questions about equity and inclusion and that kind of stuff. And so there are places that is absolutely true. And if you have time, take a look at some of Boulder, Colorado's descriptions, and you'll see at every level, even city, that they have kind of weaved it in there. And so that's one example I know for sure that I've taken a look at.
Great, thank you, Lori. Appreciate
You're
it.
welcome.
And Tim, I see your hand up as well, and I invite others to raise your hand or pop your questions in the chat.
Thanks, Anna, and thanks to all that have asked really thoughtful questions so far, and to the presenters. I wonder how you balance what's here on the slide. Don't make change too complicated. Just begin with the reality that the systems that exist currently took some time to stand up, and I want to be really intentional and thoughtful about how we evoke and exact change within our department as well as our county. There's a parallel effort, a equity work group at the county level here in Santa Barbara County, and we are obviously working within our own department to do what we can within our locus of control. But I wonder how you strike a balance between being really thoughtful and also needing to strike change, because I don't think sometimes we move urgently and we either cause subsequent harm, or perhaps that we don't get a policy just right. So I just wonder if you can give any guidance for being thoughtful in these changes.
Thank you, Timothy. And so one of the reasons I wanted to kind of end with that, because it can be quite overwhelming, because our systems are chaotic sometimes, and you'll start something like you're saying, and it'll get kind of shot down, or you'll kind of get off track. So what I would suggest is, like, take one thing, so even like job descriptions. Okay, even with the job description, what if you take a subset of that? Maybe if you start with the leadership positions or something like that, or you could start with the ones, or community health workers that are kind of already kind of going out into the community. So just break it down into kind of bite-sized pieces. And I think also just remember you are in this system, and so where you can kind of bring in the others as you kind of move along, be kind of mindful and intentional with that. And then also utilize the change management kind of techniques. And one of the biggest hallmarks of change management is communication and getting feedback. And so as you begin to do anything, let your staff know, hey, we're putting this group together. We're trying to take a look at this. We're going to take a look at 1, 2, 3 things, right? And before we get started, we want your input on such and such and such. So just make sure you're constantly kind of letting them know kind of the little journey that you're taking, and over communicate if necessary, and always create opportunities to get feedback on what you're doing. So if you get a job description that's done, you don't have to send it out to everybody, but little subsets, find some subsets that could kind of take a look at and see if you're kind of on the right track. Does that help, Timothy?
I think so. Yeah, we're establishing an equity change team now, and so again, I want to be thoughtful and make instill culture change as opposed to just putting a band-aid on a problem. So I appreciate the insight. Thank you.
Yeah, please take a look at the change management work, and I think that'll help you tremendously. Just if you don't have something already, just Google it. 8 things for change management, that type of thing. It really does help, because I think where we fall short, to your point, Timothy, is that we don't manage the change well. It's all well-meaning, and it's probably going to eventually be beneficial, but if you don't manage it well, it can fall completely apart.
Wonderful. Thank you, Tim, for your question. Anyone else? I want to make sure we don't miss anyone. If you have any questions for Lori before we move on. Okay. Well, with that, Lori, if there are any questions that come up after today's presentation, I'm hoping that we can reach out to you to get some more of your insights. I know that the questions were really great. The feedback and the responses were really wonderful. So I know that folks here were really listening intently to what you all are doing in Stanislaus County. And I just want to say thank you so much. We're so appreciative of your time and being here and sharing your wisdom and what you've been working on and leading in Stanislaus County. So thank you so much.
Thank you for inviting me, and thank you to everyone who took the time to listen. So don't hesitate if you have additional questions. I would be delighted to respond and be helpful if I could. Thank you.
Wonderful. Thank you. As I was saying, I'm really pumped by what Lori was sharing. It makes me feel like, this feels a little more doable, but as other folks have mentioned, these are systemic wide issues. And so we're going to dive a little deeper into, this workforce development ecosystem that we're all entrenched in, and start thinking about what actions we can take both locally and potentially as a larger region to address equity in workforce development. So we want to start by defining what we mean by advancing equity in workforce development. Now, we spend a lot of time defining our terms, and not just because it helps us gain a common understanding, but when we analyze and think critically about these issues with an eye towards equity, it can really help unblind us to the deeply entrenched inequities in our present-day policies, systems, and environments. So when we think about workforce development, that term in and of itself may seem pretty jargony and even vague. What exactly is it? What does it encompass? And it can cover quite a lot, from the activities, policies, and programs that are used to create, sustain, and retain a viable workforce. Again, pretty broad. So we want to elevate this concept of an equitable workforce development ecosystem. It acknowledges the historical presence of structural and systemic racism that are barriers to prosperity for BIPOC people, and as well as current policies and practices by which institutions have perpetuated that racism. Again, we wanted to elevate this because it requires us to think more critically and acknowledge the historical presence of structural and systemic racism that are barriers to prosperity for BIPOC people. It also makes us question, what are those elements of the ecosystem that need to be addressed, and what associated policies and practices continue to perpetuate those inequities? This framing implores us to recognize that it is simply not enough to improve job opportunities for people of color. We must begin to acknowledge and address the systemic and root causes that continue to drive the inequitable outcomes we see today. So what do we see as part of the workforce development ecosystem? Well, there are several elements that form part of this whole workforce development ecosystem. For example, it includes how we recruit and conduct outreach, our hiring processes and qualifications for positions, as Lori mentioned, how we create opportunities to keep people on staff, opportunities for personal and professional development and growth, and how we develop knowledge and skills to increase competency and expertise for certain roles. And part of thinking about an equitable development ecosystem is ensuring that equity is a through line in all of the ways that we approach and think about our workforce. And when we utilize equity as a through line, we are able to consider more meaningfully how we're using our own power, influence, and roles within our institutions to either contribute to or dismantle racism. As practitioners in this virtual space together, we inherently know that we continue to see stark disparities between people of color and white people on almost every measure of economic well-being, including employment, income benefits, and wealth, regardless of educational attainment. So we're going to take a few slides to talk about, what is the current workforce, what is the current makeup of the workforce, and what is our baseline currently?
So to dive deeper into the numbers on the current state of the workforce, this will be a little recap of some of Lori's introduction and a recent report titled Race and the Work of the Future, Advancing Workforce Equity in the United States, find that POC make up nearly 2/5 of the US workforce between the ages of 25 to 64. That was question one. But we know that the demographics of the workforce are rapidly changing. White people make up 62% of the US workforce overall, but represent 75% of those ages 55 and older. So why is this important? Because as baby boomers retire, they are being replaced by a much more diverse generation of workers. But even if the racial gap decreases, we see that workers of color are underrepresented in good jobs. White workers are about 75% more likely than workers of color to hold good jobs, which are defined as those that are well compensated, stable, and resilient to automation. And while higher education narrows racial disparities in labor force participation and employment, it does not equalize income or result in similar wage compensation, such that Black workers with an associate's degree earn less than white workers with only a high school diploma. And so these gaps and inequities across our workforce create a drag on our recovery and further perpetuate historic and present day racial inequities. So now let's take a look at data specific for the public health workforce. And again, this is data from the 2017 Public Health WINS survey from the Debumont Foundation, which provides a brief snapshot into the workforce. So real quickly, we see that in 2017, approximately 6 in 10 of the public health workforce identified as white. Now, this has likely changed over the past 2 years with the rapid hiring of staff in response to the COVID-19 pandemic. We also see that this is a largely female-dominated field with 8 out of 10 identifying as female. And so you were all very close. Majority indicated it was 6 in 10, but we're more closer to 8 in 10. And lastly, we see that the population tends to skew older, leaving great potential for losses in institutional knowledge as a subsection of the population plans for retirement or leaves the workforce. So the unfortunate reality is that we don't have good, consistent data collection on the demographics of the public health workforce. So while this provides a good snapshot in time for 2017, we know that these numbers have likely shifted due to the COVID-19 emergency response. And now let's shift from demographic data and think about retention and changes in the public health workforce. So continuing along with a little bit about what Lori was uplifting. Looking at this graph, you can see that nearly half of the workforce is considering leaving their organization in the next 5 years. This is consistent with what you all uplifted as well in the poll. And so let's go ahead and look at the reports. Before we look at the reports results, we want to hear from you all and see what is it that you are seeing in your jurisdictions. So we invite you to share with the group what are potential motivations or key reasons for leaving. And feel free to come off mute or drop your thoughts in the chat. You might have already had some thoughts, especially after listening to Lori. So let's see what we have. So stress and burnout, that stress and burnout was definitely highlighted in the poll as well. Anyone else have thoughts? I see here, Ryan, is this data national or state? This is national, I believe. We see retirement or moving to larger counties, little opportunities for advancement, leaving to accept permanent positions. We have some more come in, non-competitive pay with private sector, contracted positions that have an end date and not always guaranteed for next year. Thank you. And grant-funded categorical funding, work-life balance. So we see that there are several reasons for why we see this issues with retention with the public health workforce. So now let's go ahead and see. Here we find that according to the 2017 national survey, the top reason among public health workforce for leaving a job was pay, lack of promotion opportunities, and workplace environment, which is something that was echoed in the chat, but a more recent survey would likely move stress and burnout to the top of the list. So thank you all for engaging in the chat.
And as Delia mentioned, stress and burnout is likely in the top reason for leaving a job in the public health field now more than ever. And we have more recent findings from the 2021 survey from the de Beaumont Foundation that are worrisome and reflect the state of the workforce barely 1 year into the pandemic. The survey found that over half of public health employees reported at least one symptom of PTSD. Nearly a third of public health employees are considering leaving their organization in the next year, and many, especially leadership, reported bullying, threats, and harassment. And perhaps what is most heartening in a slew of troubling findings is that our workforce in general remains very committed to their jobs and their communities. And we know that all of these issues that are coming up are not new. The COVID-19 has only exacerbated longstanding inequities. Between 2020 and 2021, at the height of the initial COVID-19 pandemic response, the Public Health Alliance conducted dozens of key informant interviews with public health leaders and stakeholders from across the state. From our interviews, we found that COVID-19 exacerbated previous ongoing staffing shortages, that staff often did not reflect or represent the communities that were most burdened by inequities and disproportionate health impacts, that there was a lack of specialized staff that required specific training like epidemiologists and public health nurses, and staff that served other critical public health programs for communities disproportionately impacted by inequities were often diverted in the response. And many LHJs are frequently in crisis mode and therefore unable to continually prioritize health equity and the social drivers of health. We can see that a key takeaway from the findings from these interviews is that COVID-19 exacerbated existing workforce inequities, and there are several ways that these can play out. And we'll highlight two examples that we see systemic discrimination, bias entrenched in the workforce development ecosystem.
So when it comes to hiring processes and race, there have been a lot of studies that have documented the impacts. Many of you may already be familiar with a landmark study that from 2 decades ago that showed job applicants with Black sounding names were less likely, 50% less likely to hear back from employers compared to candidates with more white sounding names, even when the resumes were otherwise identical. And more recent studies have found similar trends. But these are missed job opportunities that demonstrate the implicit bias and systemic discrimination that is entrenched and permeates just one part of the workforce ecosystem, which impacts people of color most deeply. And researchers have gone back to staff and human resource managers that have largely been surprised by these findings. They claim that this is not intentional, but to counter this implicit bias, some companies have taken to removing names from resumes.
We can look at another example that looks at gender bias. There has been a lot of research into implicit bias, including this study on gender in symphonies. Now, for years, orchestras and symphonies had primarily male performers. And for years, they've been trying to recruit female musicians, but with little success. So they did something different. They put the person that was auditioning for a position behind a screen, so the conductor could only hear the music and not see the performer. And what they saw was astounding. There was a large and immediate increase, depending on the orchestra or symphony, in the percent of females from 25 to 46%. One researcher even began to take it a step further and looked at the impact of hearing someone walk across a stage. Removing the influence of the sound of someone's footsteps and the type of shoes, amazingly enough, meant an additional 10% increase in the number of women. Now, can anyone, I think I kind of gave it away, but can anyone guess why they were listening to the sound of shoes? You can put your response in the chat. Maybe not Prada, but yes, women are more likely to wear heels. And so they were, the sound of heels were like triggering that implicit bias in before the person even played, and even if they were behind a screen. So this was really remarkable to kind of see play out that this one factor was still influencing people. And I want to also recognize that we've been really emphasizing and reviewing examples of racism and discrimination in the workforce development ecosystem. But we want to leave space to recognize that there are other ways that there are systemic discrimination in the workforce. What other examples of inequities do you see in the workforce? Are there other isms that are contributing to the gaps that we are experiencing? What are some that you can think of? Ageism. Yes, I think there's definitely something to do with ageism. Colorism, absolutely. Tim, thank you for adding that. Persons with disabilities, absolutely. How are we making our workspaces accessible? Ableism, Educational attainment, absolutely. Are we inflating our educational requirements and adding more value to that than we need to? I would also add things like misogyny, gender bias as well. So there's clearly a lot that needs to be unpackaged here. So thank you for all for adding in those suggestions in the chat. So as we can see, and as I know many of us already know, racial inequities are entrenched in the workforce development ecosystem, as well as other types of discrimination and bias. And while we see that the problems of the workforce inequity are national and permeate across industries, we can acknowledge that some of the best solutions are local and within our reach. Advancing equity in workforce development is critical and necessary to promoting and achieving a thriving and resilient economy and recovery that benefits all members of community, and in particular, people that have been disproportionately impacted by inequities. This work requires bold action, coordination, collaboration, and solutions that are integrated across multiple systems and departments. Seems easy, right? Well, our team conducted a scan of the literature, and we looked to resources from leaders in equitable workforce initiatives, and also elevated our own findings and recommendations from interviews we conducted with key stakeholders and leaders from across the state. And we offer the following 6 top-line recommendations, and we'll provide some examples on how these can be put into practice.
Thank you, Anna. So the first recommendation we want to elevate is to talk about how we can make racial equity a priority and develop systems to track and measure progress. So there are 2 examples we will highlight. The first is that deep structural inequities are often masked by aggregated data and metrics that do not capture the specific experiences of different groups. So we can look for ways to disaggregate data in our systems. By prioritizing disaggregated data, we can utilize granular insights on differential outcomes to drive systems change. Now, another way to think about this in action is to create a health and wellness scorecard. You can do so by creating a worker health and wellness rating system and scorecard for employers, and develop incentives for meeting defined scorecard standards. Now, this will allow you to uncover any differences across departments, across race, and therefore get to the root of differences in workforce culture. The second recommendation is to ensure that people of color and low-income residents are prepared to enter and succeed in the labor market, which supports in creating a community-centered workforce. And there are several ways to think about this. Lori definitely uplifted a couple, but here we have that the first is to collaborate with other institutions, organizations, and groups to define the specific skills and aptitudes needed to succeed in organizational jobs. So you can partner with local CBOs and other intermediaries to ensure training is accessible. The California Future Health Workforce Commission identified the expansion of pipeline programs to recruit and prepare students from underrepresented and low-income backgrounds for health careers as the #1 priority in their 2019 assessment of communities' health workforce needs. We can also do this by expanding the networks of community health workers and promotoras that are uniquely placed to increase community outreach and provide support for impacted communities. You can also include community organizer positions and formalize those within your local public health department staffing structure. Sorry, it seems we have another guest speaker. And so I'll go along. An example of doing so is well before the COVID-19 emergency, the Shasta County Community Action Agency established several community organizer staff positions supported through public health realignment funds. The community organizers are tasked with working directly with community members, formal and informal leaders, and CBOs to identify community assets, needs, and priorities to advance policy systems and environmental changes. In order to reduce barriers to employment, the positions do not have educational requirements and give preference to applicants who are bicultural or bilingual, who are from impacted communities, or have worked with marginalized communities. Shasta Public Health County, the Public Health Services leadership described the staff in the role as a trusted partner and advocate as one of the county's greatest assets in responding to the COVID-19 emergency, and noted that the Shasta Public Health Services' ongoing commitment to hire more staff from impacted communities. And lastly, we can look for ways to invest in innovative training and credentialing models. This can look like partnering with your CBOs, high schools and community colleges, reentry programs, social services, and other workforce development programs to establish paid public health internships and mentorship programs and career pathways. We can think creatively for ways to provide skills credits for volunteers, such as certificate programs or a public health corps, and finding ways to design workforce training programs that empower workers, such as integrating workers' rights and labor standards training and wraparound supports into workforce development programs.
The next recommendation is looking at how we can dismantle systemic barriers and develop and implement intentional strategies to recruit and retain a diverse and skilled workforce. This can look like creating training programs that focus on skills rather than degrees. And as Lori mentioned earlier, are there unnecessary educational requirements that are posing a barrier to individuals that may have their associate's degree or no degree, but have many years and applied skills in the workforce? Where possible, how can we remove barriers for justice-involved individuals? There are efforts around banning the box, but what other steps can we take to ensure that we are providing these opportunities for justice-involved individuals? In this next recommendation, we also want to elevate recommendations that address retention and workplace culture and environment by looking at how we address white supremacy work culture and design programs and partnerships to address inequities in the social determinants of work. What do you think about when I say white supremacy culture? Does anyone have any examples or any thoughts around what this might mean? And I can certainly provide a few examples. Arbitrary dress codes, potentially. Some that come to mind for me, a sense of urgency, perfectionism, yes, emphasis on productivity, power hoarding, progress being tied to growing bigger or doing more. And just want to acknowledge that we all live in a white supremacy culture, and these characteristics show up in the attitudes and behaviors of all of us, people of color and white people. Therefore, these attitudes and behaviors can show up in any group or organization, regardless of the makeup of that organization. And part of the complexity of dismantling white supremacy is that people of color, though marginalized within a white supremacist society, might also be complicit in and or actively contributing to perpetuating norms and behaviors that map onto a white supremacy culture. These responses are great, and I encourage you all to take a closer look into what that means and how that could be showing up in your organization. But I also want to highlight that white supremacy culture can also dictate what types of programs and benefits we offer to employees, and programs that are often critical to retaining staff and providing good work environments. We can think about childcare and family care, paid family leave, transportation benefits, cross-sector partnerships to address housing, remote work. For example, early in the COVID-19 pandemic response, the city of Oakland expanded protections and benefits under the Emergency Paid Sick Leave Ordinance to improve access and increase pay rates. This is what I would say is part of what Delia mentioned earlier as part of what constitutes good jobs. Closely related to social determinants of work is looking at systems change in employment practices and culture, which is adopting and implementing structural changes to internal policies to retain, support, and promote staff with a specific focus on communities most impacted by inequities. Employers have a critical role to play in advancing workforce equity. It is important for local health jurisdictions to implement changes in internal policies and processes to retain and support staff, especially staff of color and staff from communities most impacted by inequities and other marginalized communities. Local public health departments can implement policies to cultivate a culture of equity, transparency, accountability, including salary transparency and equity policies to mitigate pervasive gender and race ethnicity wage gaps, and policies that provide clear and supportive mechanisms to report and address discrimination and harassment. It is critical that local health jurisdictions adopt transparent promotional practices as well and prioritize promoting staff of color and from impacted communities to management and leadership positions as appropriate. And finally, there are several learnings and processes that were implemented as part of the emergency response to COVID that can be institutionalized. We can think about our local contracting and procurement, our rapid hiring practices, outreach protocols, etc. So for example, in order to meet the urgent need for staff to support the COVID-19 response, local health jurisdictions worked quickly to rapidly hire and onboard staff, including case investigators, contact tracers, nurses, and others. Department managers worked with internal HR and hiring departments or private temporary services to increase numbers and department capacity as quickly as possible. Shasta County Health and Human Services Agency was able to hire over 80 temporary staff to support COVID-19 response activity, while the Riverside Health System was able to hire 360 new employees in 7 weeks. Some local health jurisdictions describe strategies to increase the diversity of hired staff by working closely with hiring managers to prioritize hiring multicultural and multilingual staff reflective of the communities most impacted by COVID-19. I hope that through these examples and recommendations for actions, you can start to see where you can impact your local organization and where you can start taking action. In our next breakout, we'll dive in deeper for a little bit for some cross-learning, sharing, and thinking about these regional implications for action. So I'm really excited and really honored that we are going to be joined by our next guest speaker today as well. We have Alejandro Juarez with the Multnomah County. He works as the Workforce Equity Manager from Multnomah County's Office of Diversity and Equity. He manages the county's Workforce Equity Strategic Plan. And in addition, he oversees the county's Employee Resource Group and Equity Empowerment Lens training programs. Alejandro is a trainer, facilitator, and mediator specializing in workforce disputes involving protected classes. He is originally from Southern California, and his family continuously reminds him to visit. Alejandro reads many books, but now just listens to them on Audible while going on long walks or folding in the laundry. His favorite quote comes from James Baldwin, who was vigilantly skeptical. "I don't trust what you say because I see what you do." And Alejandro, after spending 3 years outside of Seattle, I definitely understand those questions from family of when are you going to visit? So we are so pleased that you're here joining us. I don't think you warrant any further introduction, so I will hand it over to you.
Well, thank you so much for inviting me. I think originally we had a check-in about a month ago, or maybe longer than that. And there were so many things that, like as we were engaging in that conversation around workforce equity and like how it came about and, all of the nuances. We've been in this journey for 5 years, a little over 5 years, actually, since 2017. And there's been so much, including an entire pandemic in the middle of that. And so I really wanted to figure out like, what is the essential thing that we should kind of like begin with. And it really was the organizing that happened amongst the staff. Our workforce equity strategic plan wasn't something that came from HR or from our leadership or from a specific person in a manager supervisor position. It really was demanded by the county employees, specifically the county employees of color. And part of that dynamic is that we do have an employee resource group program that is very tied to our union. So a lot of our members who are part of our employee resource groups are also stewards, are also longtime staff people who have been engaging in multiple ways. In addition to that, we have a lot of community partners who had been complaining and demanding that we do something about the diversity of our staff because of the diversity of our community and our inability to serve them in a culturally responsive or trauma-informed way because it didn't speak the same language, didn't come from the same culture, or didn't even have an understanding of the communities that they were serving. So all of those things came together in 2017 at a board hearing where the staff kind of took a risk and literally put their jobs on the line to demand that the County Board of Commissioners take specific steps to address workforce equity issues. And so I edited down this. It was like a 3-hour board meeting. So I edited it down to 7 minutes. I'm trying to edit it down to 7 minutes. And I want to share that with you because I think it really gives you the perspective of why the county took this so seriously and immediately started implementing some of this work. So just troubleshoot this.
I know that there are people at all levels of our organization who have experienced racism and felt undervalued. It is critical that we look at the systemic barriers within this organization, their roots, and take action. And that is why today's resolution is so important. Institutional racism is very real, and it's present in government institutions, including Multnomah County, in ways that are both overt and insidious. But this does not have to be our future. It will not be, it cannot be. We must tear down barriers to hiring, promoting, and retaining a diverse workforce. I'm thankful for the leadership of our Office in Diversity and Equity and for the employee resource groups, community members, and organizations that have kept this important issue at the forefront. Your advocacy and partnership have been necessary and integral and will continue to be as we dive into the data and draft action steps.
This board and boards before it have heard from our communities. We have seen the data. We know the analysis that show communities of color and other populations experience disparities across a wide range of economic and social indicators. Our own internal data has shown that employees of color, LGBTQ employees, employees with disabilities have disparate experiences reflective of those identities. And that while our employee population overall is fairly representative of the diversity of Multnomah County as a whole, the concentration of these same communities tends to reside in lower classifications.
My name is Scotty Scott. I use they and them as my gender pronouns. I'm the co-chair of PRISM, which is our LGBTQ+ employee resource group. And we're in an era where public service is in decline, where millennials are choosing to go into the private sector rather than to serve their communities. And honestly, I don't blame them. If they carry any identity that is marginalized and that is oppressed, they won't come here because they know. But what I did hear in our session with PRISM and with many of the other sessions is that our employees love their jobs because they want to serve their communities. They want to help their communities. And they want to make life easier for people that look like them, that come from where they come, and that share the same lived experiences that they carry.
Hello, my name is Emily Purry, and like Sherelle, I had absolutely no intention of speaking today, just here in support. But I felt that I needed to represent my community in this issue, and that is the community of people with disabilities. Because people with disabilities here at the county have very little support, and they're so scared to come forward. I'm proud to be an employee of Multnomah County because many of my community members aren't able to get jobs and aren't able to hide their disability as well as I can to prove to the workforce that we are able to hold jobs, even though we work longer hours than we're supposed to. We do things we're not supposed to because we're afraid to get fired or to admit that we can't complete the task in the given amount of time. And so we do everything we can to keep our jobs.
My name is Larry Turner. I work for Multnomah County Mental Health and Addictions. Currently, my position is bicultural African American to targeted population to get African Americans who are in need of drug and alcohol treatment into treatment. The state of affairs for African Americans in Multnomah County has been in despair for the past 20 years. The state of affairs with employees in Multnomah County, African American employees, is in sad shape. It's a war on blacks. It's a war on blacks in Multnomah County. The data shows it. I mean, we can come in here and try to sugarcoat it and call it, oh, it's a disparity. It's a war on blacks in Multnomah County. Blacks are being targeted in the legal system. Blacks are being targeted in housing. Blacks are being targeted in health. Blacks are being targeted with economics, education. They're being kicked out of school faster than anybody else. There's a war. So there's a system in place here in Multnomah County that's designed to get these results. If it wasn't, we couldn't be saying this is from 20 years when I first started this work to now that it's going on. So obviously people want this to go on. I mean, it doesn't take a PhD to know that if 20 years ago the same thing is going on today is going on now, it's because they want it to happen. It's because they want it to happen. Black people work hard in Multnomah County. Black people are very important employees in Multnomah County. Sometimes we're the only way that people get the services they need because there's one black person working where no white people will go out there and help the people. I'm proud to be a Multnomah County employee. I work hard. I don't think anybody in the county in my position's got better numbers than me because I'm going to make sure, because those people, I know their families, I know their mothers, I know their children, I know where they come from, I walk the same walk they walk, and I'm going to make sure they get the services they need. And when they meet racism at these treatment centers, I'm going to go in and address it. So when I come to work every day, I come to work with all these disparities that I mentioned facing me as well. And then I come in and I can't get the support of my management. And when I bring to my manager's attention discrimination that I feel is going on in the workplace, he looks at me as the problem because I'm telling him what I'm being faced with. Changes have to be made here. Another thing too, it's real simple that we have a seniority system in Multnomah County. I've been knowing people who've worked in Multnomah County for 20 years since these disparities have been occurring. I've talked to them about these disparities and how we can address them and how we can get over them. Nothing's changed. Nothing's changed. If if I was underperforming at my job, if they told me you're coming in here to help these African Americans get in treatment, and I wouldn't get no African Americans in treatment, do you think they'd keep me in my job? I wouldn't want them to keep me in my job if I wasn't performing in my job. So why do we allow these people to continue to work and put these disparities on black people and punish black people because they don't want to do any work? This is tough work. This ain't easy work. We're not coming in here sitting up because we want to be cute and talk to the commissioners and hang out with y'all all day, because there's plenty of black people out there right now I could be helping. I'm here because I want to put something on your mind to let you know that we really need change here in Multnomah County.
Okay. So that board meeting, that hearing happened in 2017, and it really kickstarted the county's response to addressing this issue. And I think what it really did in terms of changing our perspective around how we deal with employee relations is that it took this public health framework for how to work within communities, an upstream model of looking at disparities and looking at solutions, and applied it to the workforce. And so instead of sending out, like looking at our demographics generally, we staff started demanding that we disaggregate all of our data to see to be able to see those disparities, and then start to use that kind of public health approach to start addressing the issues within the workplace. And that was a pretty radical thing, because we are a union environment. And what was an interesting dynamic with that as well is that you know, our union at the time was undergoing its own kind of reckoning with race within its own membership and its own staff. So really, the employees of color resource groups and the other resource groups were the only space where these conversations around labor and workforce equity and inequities were happening. And it really even changed the way that the union now has to engage with issues, because the way that we define, you know, bargaining issues or labor issues is anything that changes the working conditions for a represented employee, and workforce equity policies do that. So it's been a very tricky, very complicated dance over the last 5 years to try to tease it all out. But first, I want to get some reactions to the video. I know that there was some stuff I should have done a trauma a piece in the beginning, because there's some things there that are pretty heavy. Are there any reactions or responses to it?
Alejandro, this is Salfa from Ventura County Public Health. Thank you very much for sharing. I think that the emotion and the detail of information that was shared by the speakers was critical to help us stand up and pay attention, and to help the commission stand up and pay attention. And their desire to put it on the commission's radar is something that has to happen. And they were very brave for coming forward to doing that. And I think that we could all learn from that. And I understand, as I'm sure those on this call understand as well, that the voice of the people is really what counts and what matters when you're trying to conduct transformational change in a community. And that's really the only voice that matters in this case. And so the sharing, I appreciate. Thank you very much. And I'm glad to know that Multnomah County is really taking some steps to addressing some of those inequities. I look forward to hearing more on the successes that you're about to experience based on what we're seeing so far.
Thank you.
This is Ryan from Santa Barbara County. I appreciate the video as well. And I took it a little bit in a different way. And to be perfectly honest, I'm a little disappointed that we have to have these conversations over and over again. And I'm getting really tired of it. So it's just at this point, like, I'm so happy to be part of this group regionally, so that way we can make the changes that need to be happening. But to see him talk about 20 years of no progress, it's just so disappointing. And I think, yeah, I find it that, you know, the work that we do is just so important.
Alejandro, you're on mute.
Thank you. And if you have any reactions or you want to ask a question, go ahead. I like having more of a conversation. But I think what was necessary was to have the actual stories and having people actually feel what those impacts are without having those resources or without having these protections within the workplace. And that really catapulted the issue within the county. It also helped that it completely embarrassed every elected official that was in that hearing, and they had to publicly take a stance and address those issues. And initially there was a list of recommendations that the staff had, or demands that they wanted to address, to be addressed immediately. And so the first step that the commissioners took was to remove all protected class complaints and investigations from any of our HR departments and putting them directly under the chief operating officer. And that was because one of the concerns and complaints was that HR wasn't taking protected class complaints seriously, or they weren't addressing those issues in the way that they should be. And so for, I think, a year, the chief operating officer actually hired some staff to run those investigations themselves. And that led to one of our biggest innovations for our work, which is our complaints investigations unit. And that complaints investigations unit is staffed by, they look a little different now, but there's currently 6 people. And they essentially do that work of anything that has to do with protected classes as defined by civil rights law. And they essentially take those complaints and then run full investigations or decide whether or not there's something there to investigate. And it's separate from our HR department. It's under the deputy COO and not under the chief human resources office, which allows it to be more, but they're purely investigations. They don't they don't have any power to provide any discipline, but they become kind of another arm that allows these conversations to happen with a lot more transparency and accountability. It's not perfect either, but it was one of the first moves that was made. And it really has changed the way that we talk about protected class complaints. And I'll share these links with you as I go along. And then after that, there was a year-long process to identify the priorities and do a staff process going into each work area for within Multnomah County and having work sessions with people to identify the biggest priorities to start addressing. And at the same time, there was a call to audit central human resources. So these two processes are going on concurrently. And it took about a year for the staff and for that and for the auditors to come together to and come up with one plan. And that's what the document that we have now, the Workforce Equity Strategic Plan, that's what that is at this point. And it actually expires, the last deadline for our WESP is this year. So we're in a process of figuring out how to renew it for the next 4 or 5 years. And so the Workforce Equity Strategic Plan, it essentially outlines the functions of HR and then comes up with recommendations, right? So we have focus area 1, which is organizational culture. And is where I think we're putting in a lot of the training, a lot of the coaching, a lot of those resources in order to address the culture aspects of the organization. Then, we have focus area 2, which was recommendations around promotion and professional development. And with focus area 3, it was retention. And 4 was recruitment and workforce pipelines. And then those series of recommendations were like either policies or structures or areas of work that were going to be created. What we realized was that we didn't actually have any of that infrastructure to do it. So I think in reflecting now over the last 5 years, the biggest thing the Workforce Equity Strategic Plan did was to create our county equity infrastructure. So when the plan was originally created, we only had 3 equity managers across the county. We have 8 departments and a bunch of different offices. And what we realized was that we needed equity manager in each department. And so that was one of the things that the addendum for the Workforce Equity Strategic Plan, the purple area, was that we wanted to essentially hire equity managers in each department, and then create the complaints investigations unit, and then change the role of our Office of Diversity and Equity for the county. So previously, our Office of Diversity and Equity really functioned as the chair's consultant. So it was mostly addressing external policy and work. And what the organizing the staff did was really draw that office to look inward within the organization. And that the Workforce Equity Strategic Plan listed out a structure for that, which created my position, which is entirely internally focused. It also expanded our civil rights office and changed some of our structure in order to be able to have some ability to negotiate with HR. And so that's the plan in a nutshell. And then, like I said, this year it expires, and we're going to try to figure out a renewal process. Originally, the way that these recommendations were created were not actually assessed by an evaluator. So it really was whatever people came up with, and then prioritized, but not actually analyzed to see if those things would actually get us to where we wanted to go. And that was a big, lesson for us as we were trying to implement things that may not have had specific goals or things that we could track. And this time around, we want to make sure that we have evaluators throughout the entire process. And is there any questions about the plan itself, or anything coming to mind for people?
I see that Abby has had a hand up for a while. So I want to make sure if she has a question, she can go ahead and ask.
Yeah, go ahead.
It does relate both to your plan and to the video of the hearing regarding the woman who gave understandably emotional testimony about being a member of persons with disabilities and struggling to get tasks done, and being fearful of mentioning that you needed reasonable accommodations. So I'm curious, I saw in your plan that there was a point about educating the staff about the whole process with reasonable accommodations. So I was curious to hear in practice how that's being implemented. Especially on behalf of public health people here, that, if any place should be sensitive to these issues and being able to comply, you would hope this is it.
Yeah, this was a big challenge. And I think, with our structure, we're decentralized HR. So we have a central HR, but each of our departments have their own HR. There are county-wide policies that they all were to implement, but the way that they're structured is different. And what we found with this process with ADA compliance was that was a huge liability, because one department may or not do what was required by law. And one would, and we had just had 8 different places where accommodations were being denied or approved, and we didn't have a centralized structure to account for them. And it's taken this long to actually start aligning the different departments around one single model on how to do it. And I think what we are actually moving towards is a centralized resource to do it within central HR. So accommodations will be handled by not by the departments themselves anymore, but by through central HR. And I think what, starting that conversation for departments was really big because, manager and supervisor had been trained or been in the county for a really long time, and were set in their ways around what they thought was or wasn't an accommodation, or, deciding whether something was a disability or not. And I think just the work that we've done around the different trainings that we developed to show managers how to go through that process has really helped the situation. We are running a survey with our within our office. We hired a position that essentially convenes people and tracks this work. Her name is Ashley, and she is a senior policy analyst and just focuses on disabilities.
Angela, I see your hand up as well.
Yes, hi, thank you, Anna. Alejandro, you mentioned for the strategic plan that I know there was no like formal evaluation component throughout, but I'm just wondering, were there any maybe informal processes that were done really to also communicate what was happening within organizations to the local communities? And just thinking that might be a strategy maybe for getting people's interest to really want to join your workforce, knowing that you're taking those steps.
Yeah, I'm part of a lot of hiring panels, and a lot of people mention the WESP as a motivator to apply for the county. And so people are still paying attention. And it's clear, like if you're a person of color and you're going to go into an environment, you look at their policies, you look to see if there are pictures of the teams to see if you're going to be the only person of color, you do those things, right? And so of course people are doing that within Multnomah County. And it was interesting to see how much of an impact it had on people's perception of the county and then decision to work here. And I think with the plan itself, like as a communication tool for the community, we had a committee that had representation from like our Coalition of Communities of Color, which is a nonprofit organization, and then different organizations that represented communities that were also part of our internal county process to really kind of have some of that accountability. The thing that really sidelined a lot of our communications and our internal processes was the pandemic, because we went about 18 months without convening the work. Or like the groups, and all of our communications and resources went into pandemic response. So we had, just a dark period where this work wasn't communicated. It continued within the departments, but there wasn't a ton of communication. Our last annual report was in 2019, and then I'm preparing the one for from that point on, and that was one of the biggest challenges. Also, my position, I've been in the position for about a year, and it was empty for 18 months. So some of the coordination work was really stalled around that.
Great, and I love that folks are popping in and asking questions. We were sort of flowing into like a natural Q&A, but I want to make sure that any other slides or any other presentation materials, Alejandro, that you have, that we can finish going through those, and then we want to make sure that we open up for Q&A afterwards as well. Oh, you're on mute again.
I also keep forgetting to share my screen, so I'm like scrolling through some stuff and I'm thinking that I'm sharing it with you, and I'm not. So my apologies. So on our public facing website, just for your resource, if you want to dig in deeper around the ins and outs of what actually happened, we have a pretty comprehensive timeline. That begins at within the first board meeting. And, I'm showing you this mostly because it shows you all of the work that had to happen in order to pull together this document. And, after the initial hearing to, decide to have a workforce equity strategic plan, it took an entire year to get all of that work together, to get the staff together, get the unions together, before we adopted the current document, which is in 2018. And then I think since then, we started realizing that there were a bunch of components that were missing from our WES, which we are now trying to figure out how to integrate. So the disabilities group ran their own survey and had a series of recommendations that needed to be incorporated into the Workforce Equity Strategic Plan, as well as our LGBT group, who were groups who were bringing up issues around trans identity, pronouns usage, and recognition. And those things are not in part of the original WESP, and we're trying to figure out how to incorporate them and make sure that we don't miss those recommendations. And then, I talked a little bit about our complaints investigations unit. And one of the big and trickiest things that we wanted to do within the for the Workforce Equity Strategic Plan was to make sure that our approach to equity actually addressed the community's concerns, or the communities that were being impacted concerns. And there's a provision within our strategic plan that talks about leading with race. And that was one of the most contentious conversations that we had to have as a county, and led to the formation of our inclusively leading with race committee that had to come up with a definition and a shared guide on what we mean when we say leading with race. And essentially, when we talk about leading with race, is that when we talk about issues, or when we talk about resources, that we're always centering race in those conversations, because what tends to happen is that when we talk about equity and diversity, we can get sidetracked around other identities, and forget that there are also people of color who occupy those identities. So I myself identify as a queer person of color, and oftentimes it's like they end up being separate conversations, and we need to actually talk about the demographics and how your identity intersections intersect. And that conversation was a huge body of work that is really informing how we report, because we have to disaggregate all of our data now. And really, when we talk about promotions, right, we look at race, but then if we look at gender, we look at women and trans people of color as well, to see if there are disparities within those things. So it becomes a more thorough model for making sure that that our policies or our strategies actually do what we want them to do. That's to say that conversation was really painful to have with groups, but in general, it really started to change the way that we that we think about our policies and our strategies. And then from that conversation, we had a series of work within the departments that have been, so essentially our Workforce Equity Strategic Plan was the floor around equity, and then the departments can do more. And so each department now, on top of an equity manager, also has an equity committee, and they actually recommend specific recommendations to their own HR that are on top of the Workforce Equity Strategic Plan. So I started off this job managing one plan, now I have 10. And that, is, I guess, what we need to do. But it's actually good in that way, in that there are some there's some work that are specific. So like we have clinics, and the ways that disparities and around work and race show up in a clinic setting are very different than, in like environmental health, or if you're or within office workers specifically. So we're getting more and more nuanced around some of those recommendations. Are there any questions about that?
And I think we're at a point where I want to just make sure I open it up, and I know folks have sort of been like holding on to their questions as you've been talking, and so I kind of want to formally move us into a little bit more of a Q&A so that folks can feel more encouraged to ask their questions. And we'll try to do Q&A until about 3:15. Want to make sure we get our break before we do the last piece of our agenda. And I know some folks have some questions, so please go ahead and drop them in the chat, or you can raise your hand or come off of mute. I have my own, but I'll hold and make sure we get to yours first. And Savannah, I see your hand up, so why don't you go ahead?
Thanks, Anna. I was wondering, and you had alluded to this around sort of evaluation. I know you're also saying you're at a period of renewal around the plan, the strategy. And so I'm wondering how you're thinking about integrating more structured or more formal sort of evaluation into the next phase and the next iteration of the plan.
It's a big question.
I know, sorry, not a simple answer.
No, I mean, it's the thing that keeps me up at night for sure. I think so. With our renewal process is right now, what we're proposing is a year-long process, and what we are heard loud and clear from this iteration of the West is that staff want to be more engaged in the solution building. So we had varied engagement from departments on how some departments just the equity manager, the department director, and HR created policies without looking at without asking their staff. In some departments, they really involve their staff and figuring out those things. And we want to make sure that the staff who, because they're very invested in it, in terms of the video, they are still feeling like that, right? They feel like they own this. And so what I'm trying to do is combine a leadership program, a fellowship, with this as the project that everybody works on. So we're trying to recruit fellows around each focus area, and come up with those, do the research phase and looking at all of our reports. So looking at our gender diversity and trans staff report, looking at our disabilities report, looking at our managers of color exit interview process, looking at our HR data trends, and then looking at what other municipalities are doing, and identifying those recommendations and prioritizing them. And then really having an evaluator there to see how these recommendations can be reported. So really looking at the report at the end, because some things you can't really make any sense of if or know whether it's going to be effective for what we want it to do. So I'll give you an example. With one of the recommendations, we wanted stay interviews, and stay interviews are just checking in with staff to see, how you can keep them there, or what's going well with their environment and what you can do more of. We had a 1% goal metric for it. So in some staffs, it would be one person, in one department, or in the health department, it was do it for 12 people. And does that help anything or give us any information? No. And so, but it was written into this plan. And what I'm trying to do is to make sure that the recommendations are tied to actual things that would change the dynamics, but also looking at what report we want to get from this, and that means that we have to take longer, and we have to bring people on board, but that's what we're proposing at this point, is a year-long fellowship process where we do this.
Thank you. I'm going to go ahead and jump in with my question as other folks may be forming theirs. But I'm hoping you could share a little bit more about how this is the plan is going in action? Like, what are some tangible examples of how you are implementing the principles or the recommendations that you've outlined for yourself? Earlier, we heard from Lori, and she was talking about how they're looking at job descriptions or education requirements. And I know that you've talked before when we've checked in about hiring cohorts or KSAs. So I'm hoping you could share a little bit more about that, of how this is actually manifesting and how you're making some improvements in your workforce equity.
Yeah, you know, I mean, I think I mentioned this before, is that the biggest impact for the West was that it actually created this infrastructure, right? And so, you know, plainly, there are ways, like there's a lot of recommendations here, and we have a ton of plans from each of the different departments and how they incorporated manager trainings, and we're looking at all of our job descriptions and doing that. But what ended up happening was that it created this pressure for each of those departments to invest in someone to do it. And so on top of, like, we had an equity manager, and then like the following 2 years, this equity manager can't do all of that work. So we hired a staff person for that equity manager. Oh, and we need a coach to do specifically equity work within HR. So we have now a new position. So originally, when we had like 4 people doing equity work, we now have over 60 within those titles, and now trying to convene all of those people that have equity in their title, because they have to do these components. We have recruiters now that just focus on protected class recruitments. We have, you know, our investigators have to consider equity recommendations with each complaint around the environment. We have 2 mediators or conflict resolution specialists within our program that focus specifically on identity-based conflicts. So microaggressions, or when, you know, when 2 people from different races or different identities start fighting, like we offer them, you know, mediation. And so there was all of these things that, you know, we were required to do, and then we had to figure out how to create that infrastructure. So it's like, I know it's not like, you know, very specific, but if you want all of that stuff, I can send you folders of that.
I'm sure folks on this call would be very interested in the nuts and bolts of how it's all happening, and, you know, what's behind the magic. Really, it's a lot of work. It's a lot of intentionality, of course. And I see a thumbs up as well. I also was curious if you could also, you mentioned this earlier, if you could speak a little bit more about the employee resource groups. I know that that is part of what you mentioned, which I'm calling sort of the inside-outside strategy, where you mentioned that community members were really coming forward with their desire for Multnomah County to do better and acknowledge their shortcomings, but that there was also organized staff through these employee resource groups and eventually the unions that were helping to move that along. So I'm hoping you could share a little bit more about the employee resource groups, their role now, and how they've just really helped shepherd this process.
So we have a pretty robust employee resource group program. We have 8, I should know this, resource groups. And there's a lot of things that happened since in the last 5 years, right? And you know, we originally had like 1 for employees of color, and 1 for people who are LGBT, and 1 for people with disabilities. And because the politics and the conversation has changed around identity and race and equity, a lot of things started coming up, right? You know, the language that was being used around trans people and LGBT people was really excluding and hurting LGBT people of color, and led to there being a queer and trans people of color employee resource group. And those dynamics started evolving as well, where like all of the resource groups now had to also think about how you know, other identities intersect within the issues that they're focused on. And at first, you know, there was a lot of fear for the groups to start kind of like splintering off, but what had actually happened was that there was a lot more collaboration, because where for example, the LGBT specifically focused group could not recruit a person of color to be on their board or in their membership to save their life. And they were like, well, there's just aren't any queer and trans people of color. But that wasn't the case. Once there was a space for them, we now have 70 members in that ERG. And you know, when you make space for those other identities, other people come in, and what happens as a result is that you end up recruiting more people to participate in this solution building. There are more people who are able to speak to issues and participate in putting on cultural events or participate in proclamations or and you know, do some communication around this work. And so there has been an evolution within our employee resource groups. But one of the big central questions that we have right now is our relationship with labor. Because like I stated previously, like our unions don't have that equity infrastructure within themselves. And HR doesn't either. And we're kind of caught in the middle because during bargaining, you know, we could be violating labor law and look like we're special, like we're special dealing if we start talking about issues that may be bargained. And so that has been a back and forth with the union and with central HR to allow us to be able to use our infrastructure to apply an equity lens to the things that are being bargained. So if you notice, if you go through our workforce equity strategic plan, there's nothing about compensation or discipline. And those are things that that would have to be negotiated in bargaining. And I think there are a lot of things that we could analyze around their effectiveness or whether they would have an impact on our staff of color or any of our staff. But we're kind of in this space right now trying to figure out how to do it. So within our employee, like our ERG, our employee resource group leadership meeting, we break it up in half. So the first half is an employee resource group meeting, and everybody participates. We give them updates, and then they kick out all the managers, and then it becomes a union space. And we allow them to do that during bargaining because we know that some of the issues that we bargained are not going to have a perspective around race or around gender or around LGBT issues, and they need to be able to weigh in. So we've been doing that, and no one's complained yet. So we don't, no one's filed a unfair labor practice complaint against us, but it is something that we're figuring out. But we do have a pretty involved and invested participation in our ERGs, sometimes too much.
Thank you so much. And unless there's one more burning question, I'm noticing that we have been flexing our time quite a bit during our meeting today. So I just want to appreciate you, Alejandro, for joining us today, for your candor, for sharing your wisdom and what has worked in Multnomah County. And just, we are so impressed and just really in awe of what you have been able to do in the county. And I also just, again, want to appreciate you for really bringing in those voices into this space. I recognize that this work has been going on for a long time, but it's still always important to make sure those voices are well represented and central to this work that we're doing, folks that are central on that core of the issue. So thank you so much. And I hope everyone can join me in giving you all a warm thank you for your presentation today and conversation.
Thank you. Well, I mean, feel free to reach out if you have any specific questions around any, if you need any like policy recommendations around anything that you see in the plan. We do have all of that work over the last 5 years. So if you are working on a particular thing around ADA or anything like that, we most likely have something that we can share with you.
Fantastic. And I know we have our office hours coming up, so I'll pose that question to our team leads that are there, and maybe we can put something together that we can send to you.
Okay.
Thank you so much.
Thank you.